Introduction. In the dark annals of history, the exploitation and abuse of enslaved individuals for medical experimentation stand as a stark reminder of the ethical boundaries that have been crossed in the name of scientific advancement. One such figure at the center of this controversy is Dr. Marion Sims, a prominent 19th-century physician known as the father of modern gynecology. Sims's experimental surgeries on enslaved women have sparked debates on consent, ethics, and the legacy of medical exploitation. Historical context. During the antebellum period in the United States, enslaved individuals were considered property rather than human beings, leading to their dehumanization and exploitation in various fields, including medicine. Medical practitioners, like Dr. Marion Sims, took advantage of the lack of legal protections for slaves to conduct experimental surgeries without their consent or regard for their well-being. Lack of consent and ethical issues. One of the most troubling aspects of medical experiments on slaves is the complete absence of consent from the individuals subjected to these procedures. Enslaved women, in particular, were often used as unwilling subjects for gynecological surgeries, enduring immense pain and suffering without any say in the matter. This blatant disregard for their autonomy and dignity raises profound ethical questions about the morality of using vulnerable populations for scientific research. Significance of Dr. Marion Sims' work. Despite the ethical controversies surrounding his methods, Dr. Marion Sims is credited with significant contributions to the field of gynecology. His development of surgical techniques for repairing vesicovaginal fistulas revolutionized the treatment of this debilitating condition, ultimately saving the lives of countless women. While his legacy in modern medicine is undeniable, it is essential to acknowledge the dark history of exploitation and injustice that underlies Sims' achievements. The ongoing debates about his ethical conduct serve as a sobering reminder of the complex intersections between medical progress and human rights. Dr. Marion Sims, the pioneer doctor. Marion Sims, a prominent figure in the history of medicine, is often hailed as a pioneer in the field of gynecology for his groundbreaking work in developing surgical techniques to treat vesicovaginal fistulas. However, behind his legacy of medical innovation lies a dark chapter of exploitation and ethical controversy surrounding his experimental surgeries on enslaved women. Approach to developing gynecological techniques. Dr. Sims's approach to developing gynecological techniques was driven by a desire to find solutions to complex medical problems that plagued women during the 19th century. His experiments on enslaved women were motivated by a genuine intention to alleviate their suffering and improve their quality of life. Sims believed that through trial and error he could refine his surgical skills and ultimately develop effective treatments for conditions such as vesicovaginal fistulas. Methods and procedures used by Dr. Sims. In his pursuit of medical advancement, Dr. Sims conducted a series of experimental surgeries on enslaved women, often without the use of anesthesia or proper medical equipment. His approach involved repeated surgeries on the same individuals, subjecting them to extreme pain and discomfort in the process. Sims's methods, though innovative for their time, raised serious ethical concerns about the treatment of vulnerable populations and the lack of informed consent. Controversies and criticisms. The experimental surgeries performed by Dr. Sims on enslaved women have been met with significant controversies and criticisms in modern times. Critics argue that Sims's disregard for the autonomy and well-being of his subjects reflects a troubling legacy of medical exploitation and racism. The lack of consent, inadequate pain management, and unequal power dynamics between the physician and his patients have sparked debates about the ethics of using vulnerable populations for scientific research. As we reflect on Dr. Marion Sims's legacy, it is essential to confront the complexities of his contributions to gynecology and the ethical dilemmas that continue to shape our understanding of medical history. Impact on enslaved women. The experimental surgeries conducted by Dr. J. Marion Sims on enslaved women had profound and lasting effects on their physical and emotional well-being, leaving a legacy of pain, trauma, and suffering that reverberates through history, health consequences, and risks. The enslaved women subjected to Dr. Sims's experimental surgeries faced significant health consequences and risks as a result of the invasive procedures performed on their bodies. Without the benefit of modern medical advancements, these women endured infections, complications, and long-term physical disabilities due to the experimental nature of the surgeries. The lack of proper medical care and follow-up further exacerbated their health outcomes, leading to enduring consequences for their overall well-being. Psychological trauma and suffering. Beyond the physical toll of the surgeries, the enslaved women experienced profound psychological trauma and suffering throughout the experimental procedures and in the aftermath. The lack of consent, the dehumanizing treatment they received, and the pain inflicted upon them without regard for their emotional well-being left deep scars on their psyches. The psychological trauma endured by these women both during and after the surgeries speaks to the profound injustices and abuses they faced at the hands of Dr. Sims and the medical establishment. Long-term effects on reproductive health. The long-term effects of Dr. Sims' experimental surgeries on the reproductive health of enslaved women were significant and enduring. Many of the women experienced complications such as infertility, chronic pain, and reproductive issues as a result of the surgeries. The lack of proper medical care and follow-up meant that these women were left to suffer the consequences of Sims' experiments without adequate support or treatment for their ongoing health needs. As we confront the legacy of Dr. J. Marion Sims' experimental surgeries on enslaved women, it is crucial to acknowledge the profound impact of these procedures on the physical and emotional well-being of the individuals involved. The stories of these women serve as a stark reminder of the human cost of medical exploitation and the urgent need to reckon with the injustices of the past. Ethical implications. The practice of conducting medical experiments on slaves without their consent raises profound ethical considerations and implications that continue to resonate in the annals of history, shedding light on the violation of human rights and medical ethics in the pursuit of scientific knowledge. Violation of human rights and medical ethics. The experiments conducted on enslaved individuals, such as those performed by Dr. J. Marion Sims, represent a flagrant violation of fundamental human rights and medical ethics. By subjecting vulnerable populations to invasive and often harmful procedures without their consent, these practices dehumanized and exploited individuals, treating them as mere objects for scientific inquiry rather than autonomous beings deserving of dignity and respect. The lack of regard for the well-being and autonomy of the enslaved women subjected to these experiments underscores the egregious ethical lapses that characterized this dark chapter in medical history. Legacy of exploitation and dehumanization. The legacy of exploitation and dehumanization resulting from the unethical practices of conducting medical experiments on slaves continues to reverberate through time, casting a shadow over the history of medicine and underscoring the enduring impact of systemic injustices. The stories of the enslaved women who endured unspeakable suffering at the hands of physicians like Dr. Sims serve as a stark reminder of the human cost of unchecked scientific ambition and the imperative to confront the ethical failings of the past. Broader implications for medical research and practice. Today, the ethical implications of conducting medical experiments on vulnerable populations without their consent extend far beyond the historical context of slavery, raising critical questions about the boundaries of medical research and practice today. The lessons learned from the exploitation of enslaved individuals underscore the importance of informed consent, respect for human dignity, and the ethical responsibility of researchers and practitioners to prioritize the well-being and autonomy of their subjects. By grappling with the ethical complexities of past transgressions, we can strive to uphold the highest standards of ethical conduct in medical research and practice, ensuring that the mistakes of the past are not repeated in the pursuit of scientific advancement. Conclusion. In reflecting on the harrowing history of medical experiments on slaves and the controversial work of Dr. J. Marion Sims, it becomes evident that this dark chapter in the annals of medicine serves as a stark reminder of the ethical complexities and injustices that have shaped the field. It is imperative to acknowledge and confront the impact of unethical treatments on enslaved individuals, emphasizing the importance of recognizing and remembering the suffering endured by those who were exploited in the name of scientific progress. The legacy of exploitation and dehumanization resulting from these unethical practices underscores the need for a collective reckoning with the past, as we strive to learn from the mistakes of history and uphold the highest ethical standards in medical research and practice. By acknowledging the profound impact of these injustices, we can honor the memory of those who, as viewers, it is crucial to reflect on the ethical responsibilities of medical professionals and researchers, recognizing the inherent dignity and rights of all individuals involved in scientific inquiry. By fostering a culture of transparency, accountability, and respect for human autonomy, we can work towards ensuring that the mistakes of the past are not repeated and that ethical considerations remain at the forefront of medical decision-making. I encourage each viewer to delve deeper into the history of medical exploitation, to educate themselves about the injustices of the past, and to advocate for ethical medical practices in the present and future. By learning from the lessons of history and actively engaging in conversations about ethics and accountability in medicine, we can contribute to a more compassionate and just healthcare system for all.